care and services. Today's session will be Living Well with Dementia. My name is Susan Slaughter, and I'm a member of the Provincial Board of the Alberta Association on Gerontology. Today, I'm your host. Before we start, I'd like to go over a few housekeeping details. We're using Zoom webinar, and so everyone is automatically muted, and you'll not be seen on camera. With the approval of our speakers, we will be recording the sessions, but your names and private information will not be shared. You will receive a link to the recording after the session, which can be shared with others. Although we will not be sending copies of the slides, they can be seen in the recording. If you're having any difficulties, you can type a message in the chat box and our tech support will do their best to respond. Our two speakers today are Suzanne Maisy and Barb Ferguson. Suzanne Maisy is the Manager of Quality Improvement in the Continuing Care Branch, Alberta Health. Barb Ferguson is the Executive Director of the Alzheimer's Society of Calgary. Altogether, our two speakers will talk for about 15 to 20 minutes. When they have finished speaking, they will address as many questions as possible within this 30-minute session. Please type your questions to the speakers in the Q&A box. Thank you to all of you for taking time from your lunch hour to join us. For those of you who have not attended previous webinars in the series, I'll begin by explaining the context of our 2030 vision for senior services in Alberta. The Alberta Association on Gerontology started the process of future planning with a Vision 2030 symposium. This vision statement was the consensus of those who participated in the symposium and in focus groups which were held across Alberta. I'd like to acknowledge Vivian Lai, our past president of AAG, for her vision in initiating this work, and Linda Stanger, our current president of AAG, for her support in continuing this work. Following the symposium, AAG involved a number of stakeholders and engaged in discussion with Alberta government on how to bring these recommendations and actions to fruition. The full policy document is available on our AAG website. I'll endeavor to get a link to that document in our chat box today. Our policy document contains directional policy recommendations and immediate action recommendations for areas important to seniors' wellness, as seen in this figure. These are the areas covered in our AAG Living Well webinar series. Now I'm going to hand it over to our first speaker, Suzanne Maisy, who will give us an update on Alberta's dementia strategy and action plan.
Great. Thank you so much, Susan, and thank you so much to all of you for joining the webinar today and letting me participate in it today. I am really happy to be able to give you a bit of a snapshot update on Alberta's dementia strategy and action plan on behalf of so many who have been working to support it. As you undoubtedly know, the prevalence of dementia is significant and growing worldwide, and in Alberta, as of end of March this year, more than 49,500 people have been diagnosed and are living with dementia. Few of us will be unaffected, and that's the whole driver of all of this work. The Dementia Strategy and Action Plan was developed with so many stakeholders, including the Alberta Association on Gerontology, people living with dementia and their caregivers, and many others. It's a health and social plan, and it was publicly released in December 2017. And it is really setting the vision that Albertans are committed to optimizing brain health and valuing and supporting individuals impacted by dementia from its onset through to the end of life. To do that and achieve the vision, we have outlined 4 recommended outcomes that outline the desired future state for Albertans. The first one really looks at all Albertans and that we all understand the impact of dementia and actively work towards optimal brain health. The last 3 outcomes are focused on people living with dementia and their caregivers, that they're supported in communities, that they receive timely recognition, diagnosis, and clinical management, and as well, high quality care and services. Those outcomes are also linked to 3 enablers that are really identified to address those broad system changes that need to happen to ensure that high quality dementia care and service. All of those are accompanied by an action plan that have the details of what needs to happen in order to get through and achieve those outcomes and the enablers, and ultimately the vision, and to help us just continue to make progress. In doing so and implementing that action plan, government has provided roughly 12.8 million to date to support those actions identified in the strategy. Cross-sectional partnerships are critical to achieving the vision, outcomes, and actions that are outlined. And we have an implementation and monitoring committee that helps us make sure that we're on track and provides us with ongoing input. In fact, Barb, my partner today, is one of those implementation and monitoring committee members. And looking back from the beginning of the release of the strategy through to March 2019, we actually have a progress report posted on the website that highlights some of the actions that were done up through that report. So I'm not going to focus on the history today, although I'll mention for you, one of the historical projects is mentioned in the AAG strategy report, and Barb is going to mention it in a few minutes. And that was the Primary Healthcare Integrated Geriatric Services Initiative, also called Figsy, because it's hard to say fast. And the Fixie Project was funded originally to advance the dementia strategy work, and it now continues federally funded. And I'll let Barb kind of tell some of the details. So today we're really going to focus on action that's still in progress, current, and going forward, and highlight a few of those things for you. And actions to date funded by government include building on some of the earlier investments supporting the dementia strategy that established First Link, which is the Alzheimer's Society's referral program to connect newly diagnosed Albertans and their families and their caregivers to services and learning resources. That early work is now being spread to remote and rural parts of Alberta by the Alzheimer's Society of Alberta and Northwest Territories and their partners. They are also developing some workplace supports for employees and employers, and focusing on establishing some volunteer dementia advisors in rural and remote Alberta. Covenant Health's Network of Excellence in Seniors Health and Wellness has been facilitating 6 different projects in 10 different rural long-term care sites to advance quality of life and dementia in dementia supports in rural long-term care. And Alberta Health Services has been a partner since the beginning in the development and in the implementation of the strategy, and working with their continuing care partners. They are currently working to address worsening pain and depressive moods in facility-based continuing care, and that's in the health-funded parts of our system. So that's in designated supportive living and long-term care. And that project is really building on the successful work done early to support the dementia strategy, and that early work was the appropriate use of antipsychotics initiatives. So both of those projects are very much focused on quality of life and quality of care, especially for people living with dementia. And they built on the success of a phase 1 community innovation granting process, and have a current phase 2 underway with 14 different projects with lots of community partners that are all working together in different ways to build innovative approaches to person-centered dementia care services in Alberta. And Caregivers Alberta, we have investments to really increase supports for caregivers, a critical part of the puzzle when you're living with dementia. At a broader level, home care enhancements are underway to allow more Albertans, including those living with dementia, but not just them, to remain safely at home longer as they age or as their care needs change. That includes expanded access to and diversification of respite, and implementing expanded options for client-directed care. And then none of us would be here today without kind of recognizing the past year we've all lived through in so many different ways. And there has been a very deliberate dementia-focused lens on pandemic response in continuing care and use of learnings and continuous adjustment to help us inform how we responded in the pandemic, as well as to inform future change. So we have prioritized the needs, both of the person living with dementia, as well as and it's in quotes, that designated family support person. The quotes just tell you that those are words that are used in some of the pandemic policy. So these have been very important lenses throughout the pandemic in continuing care. And finally, there's a continuing care legislation review and a facility-based continuing care review, both of which are well underway. The facility-based continuing care review includes discussion of the pandemic, but it's not about that solely. It's really about system integration and looking at those designated supportive living and long-term care sites and what we need to do for quality of care and quality of service going forward. And the updated legislative framework will really give us the supports to make that responsive system that's required to do what we all want to do. And finally, the Alberta's healthcare aid curriculum and competencies have both been updated, and that has led to now all of the approved HCA programs are offering the new curriculum just recently, and all HCAs, if they've graduated before that new curriculum, are working in publicly funded agencies. They now must complete some bridging modules. And so every HCA will soon have the extra learnings that focuses on dementia, including also then other kinds of things like addictions and mental health and palliative and end-of-life care. So that's just a quick snapshot, and I'm going to hand over to Barb to keep things going here.
Excellent. Thank you so much, Suzanne, for that great overview on the Alberta Dementia Strategy and Action Plan. It's been a real privilege for me to be part of that process since we started it in 2014. The number of people impacted by dementia is growing. Suzanne mentioned there's currently 50,000 in Alberta. That's going to triple in the next 25 years. So our AAG directional policy recommendation is that the important work of the strategy is resourced appropriately so it may continue. Next slide, Suzanne. So Suzanne touched on COVID-19 and dementia, and it's no surprise that families experiencing dementia are among the most negatively impacted by the pandemic. Most people living in long-term care centers have some type of dementia, and families caring for their family member with dementia at home have lost many of the vital community resources that they have come to rely on. This has led to a decrease in the quality of their lives, both for the caregiver and the person with dementia, more social isolation, and a dramatic increase in the time and type of care that now has to be provided by the family. Dr. Gwen McGann and Dr. Deirdre McCaughey from the University of Calgary did some great research on caregiving through COVID-19, and it's available on the Alzheimer's Society of Calgary's website. Through all of this, there's been little to no respite for caregivers for almost the year since the pandemic started. Next slide, please. So that leads to AAG's first recommended action. And that recommendation is that there are flexible respite options for caregivers. It's been a challenge through COVID-19 for respite, that is for sure. But as we emerge from this, we need to ensure that caregivers have choice. And that includes adult day programs, offering hours outside of regular business hours, but on evenings and weekends. We're hearing that a lot from caregivers. They need that flexibility. And also there needs to be greater options for overnight and in-home respite. Next slide, Suzanne. So at the start of the pandemic, it was absolutely devastating for families and residents in care centers not being able to spend time with one another and visit. So we are extremely grateful for the public health orders enabling designated care partners and recommend the continuation of this policy. At the same time, we do recognize the importance of families having knowledge of infection prevention and control and the proper use of PPE. Next slide, Suzanne. So I want to share with you just a poster. It's on the left-hand side of your screen. Dementia Network Calgary and the Canadian Red Cross have partnered to provide a free online training program for caregivers, and that will cover what they need to know around infection prevention and control and PPE. The free training is available until the end of March. If you or somebody you know would benefit from this, I really encourage you to go on to dementianetworkcalgary.ca to register. And next slide. Access to technology is absolutely critical. I think we're all finding that these days. We couldn't really be functioning at all these days without technology. So in care settings, it enables families to stay connected, but there needs to be internet capacity and availability of tablets or other devices and people to support residents in connecting to their families. I understand in some rural communities and also in some of the urban older care facilities, the access to the internet can be slow or non-existent. So our recommendation is that that really needs to change. And certainly at home, technology increases safety. So again, access to monitoring devices is critical and needs to be available to all Albertans requiring this. And our recommendation is perhaps this can be something that can be available through the Aids to Daily Living program. Next slide, please. And finally, primary care teams need to be supported so they can provide timely diagnosis and ongoing care to impacted families. So next slide. So our recommendation is we need to take promising and best practices and spread them and scale them across our province. Suzanne mentioned the Fixie Project, which is the Primary Healthcare Integrated Geriatric Services Initiative. And that was a pilot that took place in the Central Zone and the North Zone of Alberta. It was a cross-sector collaboration to better support primary care teams to assist people living with dementia. And I know there's more information on that in the progress report for the strategy that Suzanne shared earlier. There's also an Ontario model called the MINT Memory Clinics that was developed by Dr. Linda Lee that engages multi-specialty teams in a clinic setting to provide wraparound support for impacted families. I'm really pleased to report that Dr. Lee and her team will be running a pilot in Alberta with 4 clinics. 3 of those will be in Calgary, 1 in the Central Zone. This pilot is going to kick off in the spring, and I know all of the teams are starting their training next week, so that's a very exciting development. But I do really want to emphasize that these are great practices, but it's really imperative that we're able to make sure more Albertans can access these great programs. So next slide. Yeah, I want to thank you, but before we close, on the last several slides, you will have noticed on the left-hand side of your screen some artwork, and I wanted to share where this comes from. This was all created by people who live with dementia through the Opening Minds Through Art program, which is an evidence-based creative programming for people with dementia. It was developed out of Miami University in Oxford, Ohio. We at the Alzheimer's Society of Calgary brought it to our day program about 6 years ago. And it's been so successful that we applied for one of the innovation grants that Susanna referenced earlier to be able to provide training to other care centers and communities throughout the province. So again, we could spread this very effective program throughout so more people impacted by dementia can benefit. And I also want to say, I'm sure you can tell from this presentation, dementia is extremely complex. And it takes a collective effort for us to be able to address all of the issues associated with it. So and that includes people with lived experience. We need to hear their voices, the caregivers, the people who have dementia. And for government, our healthcare systems, our private and nonprofit partners and agencies, we all need to come together so that people impacted by dementia can live life well. And for that, and with that, I'm going to turn it over for questions.
Thank you so much, Barb and Suzanne. We have received a few questions. I'm going to do my best to be the moderator here for those questions. The first one is, how can seniors living at home access affordable Wi-Fi, affordable internet access? Do you know of any ways of supporting people?
No, and that's an excellent question. And it has been a challenge. Technology has really been a benefit to us all through this, but I think we recognize not everybody has access to that technology. And, you know, is it something that will become an aid to daily living, and it needs to be looked at through a program such as that?
But it doesn't exist at this time, as far as we know.
Not to my knowledge. Not to my knowledge. Suzanne, I'm not sure if
I don't have specific knowledge on that either. Because I don't know it doesn't mean it doesn't exist, but we haven't heard in the pandemic, and I think we might have.
Yeah.
I'm sorry, that's, I'll tell you one of our sources of all knowledge is the dementia advice through 811, although they're nursing and they're there to, but they often answer questions on a more routine basis. So they may be a source of knowledge as well.
Yeah.
Good. So go to 911 and ask your question there.
811.
Sorry.
Yeah, sorry. Yeah. Or, and also,
811.
yeah.
We have a question about the MINT clinics, the MINT memory clinics, and they're wondering where they're located.
Yeah, so they're being delivered through primary care networks. So 3 in Calgary. So the Mosaic Primary Care Network, the Bow Valley Primary Care Network, and Calgary Foothills Primary Care Network. And there's one in Central Alberta, and I'm not sure specifically what the primary care network will be. So there are family physicians within those PCNs that will be offering these with their wraparound teams of social workers, OT, pharmacists, nurses.
There's a question about supports to family caregivers. This person is wondering if there's supports available for family caregivers that she might be unaware of. Is there a listing of caregiver supports?
I recommend calling the Alzheimer's Societies in Alberta. So check for your local Alzheimer's Society. Also 811 is, as Suzanne mentioned before, is another great resource.
We have a question about the kinds of innovation projects you mentioned during your presentation. Can you tell us a bit more about those innovation projects?
Yeah, I'd be happy to. And I think Barb has lived experience too, but I'll give you a few of the cool titles of things going on with lots of partners. The Opening Minds Through Art is an ongoing thing, and I know that there's a project out of Rimbey Community Home Help Services Association where they're partnering with youth to help the people do the art. Camrose Public Library was focusing on doing some activities that were community building activities, providing dementia resource kits in the library, doing some cycling with seniors. Now, some things have been slightly disrupted by the pandemic, but they've also prompted, I think, innovations. And before I kind of do a whole lot, I want you to know that if you go to the Alberta Health Services website or put in Google community-based innovations in dementia care, they did a report about providing support in the COVID pandemic that is inspiring. And Barb, I know you have some experience with the improv theater. Do you want to build on that? It's
called the VIA program, which is, I'm not even quite sure what VIA stands for, but it's Inside Out Theater, and it's something else we tested in our day program, and it's improv theater, and it's really exciting for people. It really is great cognitive exercise for people with dementia, and it's a lot of fun. So I know our colleagues at Inside Out Theater applied for the innovation grant, and again, they want to spread it. They want to spread this promising practice. So they developed a whole training program. So I know our staff within our day program are trained to be improvisers, so they can lead the project. So now Inside Out is working with a number of care centers and other community groups around the province to build their skills to be improvisers.
Right.
We have a few participants who have suggestions to make. One participant suggested that Caregivers Alberta has many resources available to all Albertans. So in addition to that other phone number we recommended, we look at Caregivers Alberta. Someone else said in regard to the question about affordable internet access for seniors living at home, I'd recommend calling 211 as well. They have lots of great information and resources for older adults and may have some insight to offer. So that's another number to call, 211. Caregivers Alberta and the Alzheimer's Society have been excellent resources. Norquest College is providing some online learnings and have an excellent resource list. So we're getting good suggestions from our participants. Mobility for Good is for low-income seniors, and it provides Canadian seniors receiving a guaranteed income supplement benefit with low-cost wireless service and a free refurbished device. So that's a possibility, Mobility for Good. if you're receiving the guaranteed income supplement. So that would be low income seniors. And also someone said that Telus does not have a program Telus does have a program for low income seniors, and details are on the Telus site under Mobility for Good.
Great.
Great suggestions.
Yeah.
Yeah. And someone else just suggested approaching all of the providers, Telus, Shaw, Rogers, and see what they can come up with, what they might actually generate when they know that there's a need and an interest. So we have another question here from someone whose relative brother has been inside a dementia setting, a facility living environment. So this person's saying, explain to me how 28 days of isolation in his room is beneficial to my brother with dementia. None of his COVID tests have been positive. So mentally, he has declined rapidly. How come he has to be in isolation in his room?
First, I'm so sorry. I know it's been terribly difficult. And there's so many things that can go into a certain situation. So I guess you saw my email. If you have a specific situation you want us to kind of take a look at and help you, we're happy to kind of help you understand those details or find somebody who can help you better understand. When there's an outbreak going on, there is a need to balance different kinds of risks, and it's been very difficult all along the way. It's balancing the risk of actually getting the infection, sometimes the risk of spreading the infection to others because people all kind of live in the same space, and balancing the risk of the mental health. I can't give you a single answer to that. If there was no outbreak happening at that time, I'm especially interested in talking more to you because there might be some suggestions we can give. And I think it's been difficult on everybody. And I just want to say that out loud. And there's no single answer to that based on what you've given me. And I wish it was an easier question to answer just out loud.
We continue to have participants offering suggestions. So now in the chat, if everyone has access to the chat, you can go and find the link for Telus, where you might be able to find some supports for Wi-Fi. We have another person, in contrast to being concerned about internet access, saying, why not encourage letter writing for seniors, a low-tech, not high-tech solutions? Was a comment from someone.
And I think some senior centers around the province are doing that. They're encouraging their members to have a pen pal. And I think that's a great suggestion.
I do too.
There's a question about when will the resources and programs currently available in the Central and North Zone be available in the South Zone? So I'm not sure specifically what programs they're referring to.
Probably the Figsy program, because we talked about it being in the north, and I think we need to take some of those great programs and figure out ways to be able to scale them. But I'll pass it over to you, Suzanne.
Yeah, I'm pretty sure actually some of my friends and colleagues from the Fixie Project are actually here today, but I'll give you a high level. They are currently funded by Health Canada to do some deeper spread. They're focusing on wellness in those communities. They talk about it's a real community development process, which isn't something you just take from community to community and overlay it on the next place you go. I think there's also a need for the primary care networks in the various communities to wish to focus in these areas. So I think it's a combination of factors, and it's certainly an important piece to integrate primary care and our continuing care like home care and our community services together. So it's not lost that it's critical. They don't just spread necessarily immediately. And I think there's a high interest in continuing to take the relevant learnings and embed them elsewhere.
I see the time is 1 o'clock. I really want to share another question though before we close. and I'll just read what it says. COVID social distancing and isolation has been detrimental to my husband's dementia, and we're living at home. In this case, what we need is better home care resources where we can have home care that's meaningful rather than just giving caregiver respite, because we're not really, there's nowhere to go right now in COVID.
And
Absolutely.
we did speak to the need for flexibility around respite. It has to be meaningful for the caregiver. So if there's opportunities for whatever the caregiver needs, so some flexibility around what can be delivered within the home. And I know adult day programs have all kind of switched to virtual, and it's actually kind of exceeded our expectations in terms of being able to engage people with dementia and their caregivers, being able to socialize, being able to meet other people online. But again, technology is required for that.
Yeah, and absolutely. I'll just build on that. That's absolutely exactly what we're referring to when we say that we're building in that expanded flexibility and respite options in a home care. Your voice has been heard. That voice was what you've just said was true before the pandemic, and it's so much more difficult now. And I think probably most especially for the caregiver who now doesn't have, even if the day program operates virtually in your house, that's not the same kind of break. And I understand the meaning is so important. So thank you, absolutely. And that's a critical part of what's being considered in the go forward, and it's actively moving forward.
Okay. I am going to have to, unfortunately, close our webinar for now. We so appreciate everybody's participation, and I especially want to thank our speakers, Barb and Suzanne, who have taken time from many things that they're busy with to prepare and present today. So thank you, Barb and Suzanne. And you can expect as participants to receive a recording of this webinar, but also in that email that you're going to receive, you'll be asked to provide an evaluation, respond to the evaluation, and that's so helpful to the AAG as we look to the future on ways that we can be contributing to the well-being of older adults. So we ask you to respond to the evaluation as well. With that, I think we're going to say goodbye.
Thank you, everyone.
Goodbye.
Thank you, everybody.